Welcome to the Fit to Push YouTube channel. Today we're breaking down postural shifts and how they impact your recovery journey. I'm Dr. Vida Ahmad, a pelvic floor physical therapist and mom of two. I combine my specialty knowledge in pelvic floor rehab and pregnancy and postpartum coaching to create a comprehensive approach to support for your journey from pregnancy to birth to postpartum and beyond. In today's video, I'm going to show you exactly how to adjust your posture to help throughout your daily routines. We're gonna look at how you sit, how you stand, how you carry your baby to give you simple, actionable adjustments to address things like low back pain, SI pain, and hip pain so that we can get your deep core to turn on automatically like it's supposed to do. If you are weeks or even months postpartum and you're still dealing with deep nagging pain in the low back or even in the hip or SI joint, this video is for you. Go ahead and like and subscribe and follow along for more pregnancy and postpartum tips. To fix pregnancy and postpartum alignment, we need to first look at what's been happening to your alignment during pregnancy. During pregnancy, as your belly is growing, your center of gravity shifts forward to account for that weight change and that growing belly so that you don't tip and fall over. So what happens is that your lower back arches and your pelvis tips anteriorly. Your shoulders draw back so that your center of gravity stays over your feet. Your stance even widens. Now, postpartum, after you have the baby, all of these things don't just automatically shift back to the way they were before pre-pregnancy. What we need to do is intentional adjustments to fix this. Postpartum, we need to adjust our pelvis by tipping our pelvis posteriorly, shifting our weight over the arch of our feet, over the center of our feet, meaning your center of gravity or the center of your weight should be between the balls of your feet and between the heels of your feet. Slightly bend your knees and then stack your rib cage over your pelvis, drawing your shoulders over your hips and ankles. Now, this can help turn on the core and turn on the glutes. It may feel a little bit awkward at first, but it tremendously helps automatically turn on those muscles, relieving pain and stress and compression in the low back. So let's first start by addressing the mom lean. In pregnancy, as your belly grows and your ribs flare, your pelvis tips anteriorly, and we get stuck in this anteriorly tilted, really arched low back position, our shoulders draws backwards and our weight shifts forward like this. Everything in our back gets really compressed. Our SI joints are compressed and our back muscles are really tense. So to counteract this postpartum, think about slightly bending your knees. Then slightly tipping your pelvis posteriorly. So tucking your tailbone slightly. Then bring your weight forward over the arch of your feet, making sure that your shoulders are directly over your hips, which are directly over your knees, which are directly over your ankles. So think about if there was a line dropping down from the top of your head down to your feet, it would line up with your ear, shoulder, hips, knees, and ankles. And everything would be stacked directly over each other. This may feel a little bit weird, but this helps your core and glutes turn on automatically without you having to think about it. When you are holding your baby in this position, moms tend to lean back. Think about tilting that pelvis back, leaning forward, and holding that baby here. This will drastically turn on your pelvic floor and your core. You can even take a little bit of a staggered stance when you're rocking your baby and rock back and forth, as opposed to standing feet together like this. Staggered stance, rock back and forth. This takes so much pressure off of your low back and automatically kicks on your core, deep core. The next thing we're gonna address is feeding. when you are holding your baby to either breastfeed or bottle feed, don't slouch down and look down at baby the whole time. I want you to think about putting pillows, rolled up towel, or a blanket, something to support your elbow so that you're bringing baby's head up to you and to your body, and you're not bringing breast to baby, baby to chest, right? So you're supporting that elbow with a nursing pillow, a regular pillow, anything that can help prop that elbow up, right? Then you're going to, if you look down at the baby, it's going to be briefly during the feed and not throughout the entirety of the feed. The last thing to do is sit back in your chair so that your sit bones are flat. Put something underneath your feet so they are resting on the floor and they're not hovering. And then put a small rolled up towel behind your low back for lower back support. And this can help with neck tension, shoulder blade pain, and low back pain while breastfeeding. Lastly, I want to talk about low back and SI pain. And this can be varied in how you are picking up baby, bending over to change diapers, washing dishes at the sink, and whenever your back pain flares up. So first we'll address back pain while washing dishes. If you are at your sink and you have a cabinet underneath the sink, open the cabinet and put your foot up inside the cabinet. In this position, this will help lock the pelvis and relieve some of that stress on the low back. Wash dishes, and you can switch if you're there for a long time. You can do the same thing when you're doing a diaper change or when you're doing laundries. Now, putting the baby into the crib is a different story. When we're putting the baby into the crib, we cannot hinge in that perfect posture. We will round. So, what you can do then to help with back pain and SI pain during those times is holding baby. You take a big breath in, exhale as you put baby down. Take a breath in and exhale as you come back up. This can help brace the core to give the spine and lower back some support while you're still working on strengthening the core to do so. Adjusting these simple postures throughout your daily habits can significantly help reduce your lower back pain and help improve your postpartum recovery. If you're looking for one-on-one support and one-on-one help to help your postpartum recovery journey, please go ahead and click the link below to have a free 15-minute consultation. Follow me on Instagram and go ahead and like and subscribe this YouTube channel for more daily content. Thank you. See you on the next video.